Life Unrehearsed, brought to you by Caregiver Crosswalk, Dementia Care Consulting. Never roam alone.
And welcome back to Life Unrehearsed. My name is Matt Delvecchio, specializing in life transitions, downsizing in the senior living industry.
And I'm Corey Sirota, clinical social worker and author of Someone Died, Now What?
So, Corey, we're going to be talking about vaccinations, immunizations, and so on. Did you know there's a couple apps all coming out now as to when your expected vaccination will be? Have you gone on that at all? Have you tried it out?
I personally haven't put in my numbers, but those of people that I know that have are farther, or I suspect I'm going to be farther than them. So it's one of the reasons I kind of did it. I wonder how accurate they are.
I wonder. And look, it's a moving target. We just heard that Pfizer is going to be delaying some of their deliveries because of expanding their manufacturing. So who knows? I did it actually myself. I'm 54 years old, so I ask you to punch in your age,
right.
and so I'm somewhere between mid-July to mid-September is what they said for a 54-year-old. So
okay, and since I'm so much younger than you. Does that mean I'm like not till next January? I don't know. We'll see. Yeah, okay.
All right. You're on, Corey.
Yes. Well, we would, in order to clarify some of this information, we welcome Professor of Infectious Diseases at McGill University and the Director of McGill Center for Tropical Diseases, which specializes in tropical and travel health issues, Dr. Libman. He's going to demystify information about vaccines and immunization because it is so darn confusing. Welcome to the show, Dr. Libman.
Thanks. I'll do my best. At least I'm a little mystified too sometimes, so I'll do what I can.
Fair enough. Okay, so we kind of put some questions down around myths and facts. So there's a lot of information out there. Perhaps we're hoping you can comment on, let's start with efficacy rates.
Right. Well, listen, first I'll just say that we are, this is the first information that's coming out about these brand new vaccines, so everything is a bit subject to learning a little more. But what we can say is that the two vaccines that we have so far in Canada, the Pfizer vaccine, the Moderna, everybody's been hearing about, the studies that were done until now are almost unbelievably good. I mean, really, nobody was hoping for that. And, they're talking in close to 95% efficacy, and that's as vaccines go, that's pretty close to as good as it gets, and it's really good to see. But things always change a little bit between a study situation where everything is perfectly controlled and a real life situation, and we shouldn't be surprised if in real life it's not exactly as good as it seemed in the study, but it's looking like it's going to be really very good. Never perfect, but very good.
Yeah, it is quite astounding, some of those numbers. And like you say, just that's not normal. And so that's wonderful. And considering this was all done in less than a year is quite amazing. Dr. Libman, I'm interested as well to get your opinion concerning the vaccination rollout. You just heard me saying at 54, I'm looking somewhere towards the latter part of the summer. At least the latest numbers are showing that. Almost all residents in CHSLDs have had their first shot, most of the employees as well. We're starting with healthcare workers. Next on the list are what we call our RPAs, seniors residences. Those that are living in seniors residences will be starting right around now. And after that, we go into some isolated areas. And then we start with the 80-year-olds and more, which is slotted in for mid-February. In terms of the rollout, from your professional opinion, are we on the right track in making this type of priorities the way it's playing out?
Well, there's no absolute right and wrong here. There are always some difficult choices to make. And the choice, as everybody knows, in Quebec, the long-term care residences were particularly hard hit. But it's not just that those people are more vulnerable. So yes, we're trying to protect this most vulnerable sector of the population. But this was also the sector of the population that was overwhelming our acute care hospitals. And so again, there's a little bit of a political discussion to have about where we want to go first with these things. But the choice of saying first we're going to go simultaneously to to the most vulnerable sector and a group where if we can protect them, we can protect our acute care hospital system because they were, that was the group that was flooding our hospital beds, forcing us to choose what kind of other care we were going to have to reduce or let go entirely. The idea there is that if we can keep our hospitals functioning, then we can manage as we try and roll the vaccine through the various risk groups.
That's Dr. Michael Libman. He's talking about demystifying information about the vaccine and the immunizations. Let's talk about the delaying the second shot. Is it the right decision? Again, we're not holding you to it, but we just want your opinion here.
Yeah. So that's, of course, a tough one. It's a tough one because emotionally, people want to get this over with. And everybody heard that these vaccines, you get 2 doses over 3 or 4 weeks, and you're done, and you have a great level of protection, and everybody was looking forward to that. So everybody, over the new year was really hopeful, I think, for themselves personally. Then our numbers continued to really skyrocket, numbers of cases, numbers of hospitalizations, numbers in the ICU, and I think the public health authorities and the government had to look and see. It is a little bit of a rolling the dice. As everybody's repeated, we don't have really solid data on what happens when you delay this, but our most educated guess, and our educated guess, it's not really a guess. We have a lot of information from other vaccines, other types of vaccines, other types of viral illnesses that tells us that this should all be okay. But, surprises happen, and there's always the possibility that we'll have to do an about-face. But what we know about vaccines up until now tells us that it's not a risk. People should have some amount of protection. We don't know exactly how much, but they should have some amount of protection. And by getting some amount of protection out to twice as many people, all of the modeling, all of the math is suggesting that that's going to have a greater impact on public health than following the rules. Listen, it is to some extent like I said, there's a little bit of guesswork here, but we're not locked into this. And if at some point we see that it's not working the way we expect it to, it is certainly possible then to switch gears and go back to the original plan or to plan C.
Right. Talking with Dr. Michael Libman here. It's such a polarizing subject whether to delay or not. Quebec recently announced they're going to go up to 90 days. And why? The estimate is somewhere in the range of 500,000 more people can get their first shot. I was talking to Corey off here. Our very first person that received it in Quebec, this lady in Quebec City, had COVID. She had COVID. And there was talk, she did get COVID, but is there the possibility because she had that first shot, she recovered, she's doing fine? And did it give her some form of greater protection? And we really don't know. Dr. Libman, why do you think we're failing to control our rates of infection? What needs to be done?
That, of course, is the real, I guess we used to say $64,000 question. That's not a lot of money these days.
Right.
But it still is. This is something I think we're going to be learning from for years to come, trying to understand all of the different factors. It's certainly a little mysterious, isn't it? Right now, Quebec and Ontario are doing pretty badly. The Atlantic provinces are really doing pretty well. Alberta's not doing well. BC's doing better. Why? This is in Canada. In the States, it's a whole bunch of other issues that we can talk about. But in Canada, we have a fairly homogeneous healthcare system. Most people get the same kind of care across the country. Most, I think our culture is not vastly different across the country, and it's still not completely clear why some places are doing better than others. Surely crowding has one thing to do with it, so you're going to expect Montreal and Toronto and other crowded metropolitan areas to have more of a difficulty controlling things than maybe the Maritimes where there's just simply the population's not quite there. But the fact is we don't know exactly what drives things to be worse in one place, so it's hard to know exactly how to intervene. But we do know one thing, which is that there's no magic. There's no magic to this. It's a person gets the disease, they're contagious, they get close to another person, and they can spread it. That's completely straightforward. And we're learning more and more about, different conditions, indoors, outdoors, and how close you have to be, and all these things talk about aerosols and how it spreads under different conditions. So we know more and more, but the basic facts are if people stay further apart and, congregate less,
right,
that will help.
Okay, so it's very clear. We really have to go to a traffic break with Mark Chaloux, but when we come back, Dr. Libman is going to talk about his take on anti-vaxxers. Is it their legitimacy in people not wanting to get vaccines?
Life Unrehearsed, brought to you by Leanna Senior Transition Support, specialists in downsizing and seniors residences.
Welcome back. You're listening to Life Unrehearsed. I'm Corey Sirota with my co-host Matt Del Vecchio, and we are talking about demystifying vaccines and immunization with Dr. Michael Libman. Let's talk about the anti-vaxxers. Is it their legitimacy in people saying they don't want to get vaccinated? What's your take on that?
Yeah. Well, of course, anti-vaccine sentiments are not at all new. It's been ever since vaccines were invented, pretty much. And it's not one thing. And some of the things are easier to deal with than others, right? It is true that there are some people who, for a variety of reasons, are basically just, anti-science. They just don't. They just don't believe in what science is telling us, and that's a very difficult group to deal with. But there are also groups who just maybe don't know that much about it, and with a little bit of education and persuasion could be brought to the idea that the vaccines are actually a good thing. And probably one of the, if I can say, most reasonable worries, of course, is that it is a new vaccine. It's a new virus. It's a new vaccine, and people are saying, I just don't want to be the first one. Can I just watch a little bit and make sure that everything looks okay? And that of course is a normal, rational human fear. Not everybody wants to be the early adopter.
My July doesn't look so bad now.
And so all those different groups require a different approach. But I think that overall people have to bear in mind that there's in this particular case, there's a bad side to not being protected, and the bad side is not just for yourself. It's not simply, maybe you're young and relatively healthy, and the chance that you're going to have a problem is pretty small. So you can say, well, I can wait, which is maybe true. But everybody who gets infected is also a hazard to all those around them, and I think a lot of people still can't really take their head around this, which is that what we're trying to do here is promote health for the whole public. It's by getting yourself vaccinated, by taking care not to be infected in the first place. It's not just you. You're helping to protect the entire society, and that's what makes it very different from some other kind of medicine. When you take a blood pressure medicine, it's for you. It's for your blood pressure, and maybe that's going to be good for you. This is a bit more complicated. We're asking you sometimes to do things for you, but also for everybody else.
It's so interesting you're saying that. We're talking with the director of the McGill Center for Tropical Diseases. I like this angle to hear from you, Dr. Libman, and you're so right. We were on a Zoom call with some friends this past week who are American, and it was amazing. They wanted to get our Canadian take. We wanted to get their American take. And what you just brought up, I think, is so important. It can't be just about you. This is about society and their response. They're actually in Washington, just outside of Washington in Maryland, and their attitude was, well, okay, we're going to get it, but we're going to be okay. And it is so worrisome. And Corey and I deal with a lot of seniors in our professional business, and we've seen it firsthand how dangerous it could be. And we have to put we in this equation and not just I in the equation. Dr. Libman, I'm very interested to get your take on the emergence of strains. There are mutations. This is normal. We've heard some stuff coming out of England, some out of South Africa. Are you concerned about some of the new strains that we're seeing?
Yeah. I think people who know about how viruses work were always concerned about this. It's not a surprise. It's unfortunately, it's the nature of things. These viruses and bacteria and everything else, they evolve, and they naturally will evolve to be more contagious. It's what every virus and bacteria, that's what they want to do in life, right? They want to multiply and prosper. And so was only a matter of time before this new virus gets a little bit better adapted to infecting humans, meaning that it becomes a little more contagious and it becomes a little better at spreading from person to person. And of course, it was pretty much expected that it would happen sooner or later. And of course, it's a worry because more people infected means probably more people sick, even if it doesn't cause. Each individual person who gets infected is not necessarily more sick than they would have been, but it's more people, and they take up more beds in hospital and so on.
We had a text come in. Quick question, Doctor. Is it possible for someone under 30 years old who got vaccinated 1 month ago to get the virus?
So I think, so first of all, you have to get the 2 doses. The 1 dose is probably only partially protective, and we don't know exactly how much. But the second point is that the vaccine is never perfect, and people have to also keep this in their mind. The vaccine 95% is not 100%. 95% means 1 in 20 will not be well protected. 1 in 20 overall, it's pretty good, but it's not perfect. So that if you become careless, some people who were vaccinated will still get infected, and even worse than that, they're potentially contagious to those around them, which is what we worry about more. It's the 30-year-old is probably going to do okay even if they do get infected, but what about their parents and the other people they come in contact with at work or anywhere else? I mean, that's what we're worried about.
Absolutely, Dr. Libman, you bring up such a good point, and you also mentioned at the outset about how it could free up our hospitals, and I think at the end of the day, we are looking at that. The ICUs, the hospitalizations, and the deaths, those are the most important figures we're looking at, and the way this vaccination schedule is going is targeting that population that's tying up a lot of those beds, and I think you're right on when you mention that, and we do want to thank you, Dr. Libman. We know you're calling in here on a Sunday. Any final words to those people listening, our listeners, and there are the anti-vaxxers, but you're in this, you see it every day. Any final words?
I think people have to try and keep optimistic about it. They have to try and keep an attitude. I would say try and keep the attitude that says it's not just me. I'm working for all the people around me. I could mention, if I could throw in one quick word, is that for the people who really want to be a little altruistic about it, we are studying vaccines as well. This is, of course, something else, but people who want to volunteer to be part of studying some of the new vaccines that are coming out, we need volunteers for that too. So McGill, the MUHC, does have a vaccine study center, and if it's something that you think you might want to do, then give us a call.
All right. No, absolutely. Well, Thank you very much, Dr. Libman, for your time.
Okay.
All right. That's Dr. Michael Libman, Professor of Infectious Diseases at McGill University and Director of the McGill Center for Tropical Diseases, which specializes in tropical and travel health issues. Corey, real quick, what do we have coming up next week?
Next week on Life Unrehearsed, there are many decisions that need to be made when supporting the elderly. Thankfully, we have our very own Matt Del Vecchio on hand to teach us how to navigate the senior living options.
Yeah, looking forward to that. And parenting and youth development expert, Californian Dr. Deborah Gilboa, is going to share with us how to use stress to strengthen mental health and resilience. So that's next week. We want to thank you for listening, and we want to thank our technical producer, Dave Simon, for joining us. And you can catch us every Sunday at 4 p.m. on CJD 800.